after I had issues, and the closest pelvic floor PTs around here were Barberton or Hudson. So the services are newer to the area, and we're happy to be able to offer them here at Altman. We'll talk about it. If you haven't heard about it before, go ahead and advance the slide, Julie. If you haven't heard about it before, you're not alone. Most people have never heard of pelvic floor physical therapy because it wasn't available around here before. Most medical providers in this area are also not completely familiar with it. It is getting better since it's been around for about 4 or 5 years now in this area. So over the course of this health talk, we'll review the different conditions that we treat as well as what to expect if you choose to come and have us help in your care. So the truth is the pelvic floor is a very important group of muscles that sits in the bottom of the pelvis that is our true core. So these muscles help to hold up everything that's within the abdominal cavity. And we really don't know that they're there until we start having problems with them after things like childbirth or surgery or any kind of trauma. And then we're not quite sure what to do to fix them. So we'll discuss the problems that arise and what we can do to help when these muscles don't properly work. So you can go ahead and go to the next slide, Julie, if you would. So this is a list of the different conditions that we treat. We often hear that people didn't know that there were therapy to fix these things. Both males and females have a pelvic floor, so they can both have the same kinds of problems, believe it or not. So problems with the pelvic floor can be for several reasons. The muscles may not be strong enough. They may be too tight. People may have had surgery that can lead to scar tissue, such as any kind of abdominal surgery or hysterectomy or cesarean, any kind of trauma such as childbirth or car accidents, falls, all of those sorts of things can all impact the pelvis and the muscles that are all to it. The trauma from the delivery as well, or any kind of radiation to the pelvis that's happened due to any kind of cancer that's been in the area can all change the tissue in the pelvis and change how those muscles function, which can cause all these kinds of symptoms, things like constipation, pelvic pain. We have a myriad of different things that we deal with pregnancy and postpartum, including diastasis recti, which is the separation of the abdominal wall that can actually lead people to have back pain for a long time after delivery. And a lot of people don't put the 2 and 2 together, that it's the separation of the muscles that's actually causing their back pain. So those are just a handful of the things that we treat. And again, those are both males and females. But as you can see, the problems that arise from it are pretty variable, and so is the treatment. So a lot of people think that Kegels is the solution to pelvic floor problems, but that can't be further from the truth. Most people can't do pelvic floor contractions properly in the first place. And if muscles are too tight or someone's having pain, the last thing we want you doing is trying to contract muscles that are already too tight. So it's important that you work with us or someone that knows what they're doing to make sure that you can properly find the resting position of those muscles. Are they too tight? Are they too weak? Or are they causing generation of pain? So that's why it's important to be sure you're seen by a pelvic floor PT. And your pelvic floor PT will review your history and your symptoms. They'll complete a comprehensive exam to make sure that we have the proper care plan for you with your concerns in mind. We do have 2 pelvic floor therapists here. You saw our names on the first slide. So there's me, my name is Darla, and then we have Samantha as well. We'll talk a little bit more about our training here toward the end of the presentation. So you can go ahead and go to the next slide, Julie. So it's time to talk about it. These conditions a lot of times are considered taboo and things that aren't discussed, and they really make an impact on people's lives. So even though these symptoms are common, people laugh and joke about how they pee themselves after they have a child. It just gets worse as you get older. So the sooner that we deal with it, the better. It's actually the standard of care in the United Kingdom. After all women deliver children, they have pelvic floor PT. Because the sooner that we address the problems, the faster we can fix them, especially in young, healthy individuals. And then the problems don't compound themselves over subsequent pregnancies. And then we have someone in their 50s who has problems that we could have addressed sooner. So again, they might be common, but that doesn't mean that problems are normal. And they can really negatively impact a person's ability to interact socially, interact in their relationships and ultimately their overall quality of life. So these are pretty staggering numbers when you look at them. 1 in 3 women experience urinary incontinence, and even men after prostate surgery, prostatectomy or prostate removal is a common treatment with prostate cancer. And a lot of these guys, even a year out, 40% of them are still experiencing incontinence requiring pad usage. So that is something that can be drastically reduced, if not resolved, with pelvic floor physical therapy. Okay, so we can go ahead and go to the next slide. So what to expect if you choose to let us help take care of you. Pelvic floor physical therapists, it's not an entry-level training. So PTs coming out of PT school are not trained in this. This requires extensive training outside of PT school. So Sam and I both have DPT, which is Doctor of Physical Therapy. We're both Walsh University grads. And then we are trained in APTA, which is the American Physical Therapy Association's levels 1, 2, and 3 trainings, as well as pregnancy, postpartum, and cancer management. Your care here is provided in a one-on-one room. So this is not provided downstairs in the general therapy gym. You're actually taken care of upstairs. You do your general paperwork downstairs, but then after that, you come upstairs and all treatment is done up here. Your privacy is very important to us, as these are very personal issues that you're dealing with. So we make sure that your privacy is taken care of upstairs and away from everything else. So you remain with your therapist through the duration of your care. A lot of people who have had experience with typical PT, you're seen by a therapist and then you're passed to a PTA. That's not how we do pelvic floor physical therapy. So Sam's patients stay with Sam, my patients stay with me, unless for some reason you choose to switch therapists, or if you want a certain day that one of us isn't here, but you're aware of that before that would happen. So a comprehensive exam is completed over the first couple of visits. The lower back, the hips, and the abdomen can all contribute to pelvic issues. So we have to make sure that we take all of that into account. We are trained in pelvic examination, but that is just a small component of the exam. And that's not always something that's needed to be done on the first visit or with every patient. So our goal when you come here is you're dealing with something that is very personal in nature, and we want to make sure that you're not uncomfortable while you're here. So we have people who have histories that make it very difficult for them to be able to sit through a pelvic exam. So we don't always have to do that with every patient. It's dealing with what you need to deal with while keeping you comfortable. So we go through the exam, we base your symptoms, everything is explained to you for us to figure out the best way to address your symptoms. And again, the pelvic exam isn't always performed during the first visit or needed with every patient. So it's only completed if you're comfortable with it. But then after reviewing your symptoms and your history, we'll go through what our findings are and create a plan to address them with you. We understand that people are busy. So multiple office visits during the week is not something we typically do with our pelvic PT patients. So we understand you're busy. So a lot of the stuff that we do is actually home-based. So our patients are seen at most once a week in the office, sometimes every other week. So it's more based on what you need. We do have evening hours here, which is helpful because we know a lot of people are working later. So Sam and I stagger our schedules. Most of our patients are actually better within about 3 months or less. We typically have people out in less than 10 visits. And with the current state with COVID, a lot of insurance companies are allowing us to see patients via telemedicine. So that's something that you can address with your therapist and find out if you are a good candidate for that. So anybody who needs hands-on work, that's kind of hard, but that's something that we can address and figure out what would work better for you. So you can go ahead and go to the next slide, Julie. Oops. All right, so that's just a general overview of pelvic floor physical therapy. This first presentation, we didn't want to go into a whole lot of specific symptoms that we treat because we could do several presentations over them. But a lot of people ask the question, does my insurance cover this? The answer is yes, sort of. This is billed as regular physical therapy. So if whatever copays that you would have or out-of-pocket amounts that you would have for regular physical therapy is what this is billed as. We bill as regular physical therapy codes. So if you have questions regarding what your cost out of pocket would be, just contact your insurance company to find out what those copays or out of pockets would be. A referral is needed to be able to come and see us. So that can be from your physician, nurse practitioner, midwife, primary care provider, chiropractors, if you're not a Medicare patient. So again, and the telehealth visits are covered under a lot of insurance companies right now after the evaluation. So the first visit has to be in person, but then after that, some insurance companies are allowing us to do telemedicine. So we can check on that if that's something that you're interested in. And then we did list our emails on the bottom slide here. So a lot of times people have questions that they're afraid to ask in front of people, or they want to have something if other questions come up later. So those are both our Altman emails that anyone that has any questions after the presentation, if you don't want to ask during, you can feel free to email us at